The goals are to understand a few concepts. One is the concept of developmental surveillance. What exactly is that when we say developmental surveillance? To understand the difference between that and developmental screening, and to know when you should be concerned and administer specifically an autism screening test as opposed to just a general developmental surveillance test.
Matthew is now 18 months old and is coming in for a routine healthcare maintenance visit.
Although Matthew is
a quiet and sweet boy, you remain concerned about his language and variable eye contact.
Your next patient is
Claudia, a 2-year-old girl who has just moved to the area from another state. This is Claudia's concerning behavior and lack of words. You and your preceptor agree that these may be assigned thoughts to Claudia's dad for completion.
So surveillance is taking the history in combination with your observations, and you should be doing that at every single checkup that you see a child with. And then basically you have tools usually within your primary care visit that are kind of helping you jog your memory about what that child should be doing. But that's kind of what the process of surveillance is making those notes, and that there is actually a process in your mind you should be going through. Yes means that they passed, okay? So the answer key is for the items that are passed. So if the answer on the scoring instructions does not match what they answered, they fail that item. Get it?
Mm-hmm.
If the answer is in italics, that means it's a critical item. To fail this test, you have to fail 2 critical items or 3 items total. What was Matthew's overall score?
3 non-critical.
So does he pass or fail? Fail. He fails. And Claudia, you all seem to have different reactions to these MChats, right? Obviously you're more worried about Claudia than Matthew, right?
Mm-hmm.
How does it change how you would approach these 2 cases and what you would recommend to the family? You know, what would you do?
I think in this case it almost confirms your suspicion.
Mm-hmm.
Whereas with Matthew, he's under that umbrella, so your reason for doing the MChat is, is warranted. But you can also tell the parents, explain to them that this is a sensitive test, but maybe not specific.
Correct.
But it's worth looking into further.
Yeah. For Claudia, what would you?
I mean, I would just say based on your evaluation and knowing the diagnostic criteria for autism, that there's probably a high likelihood that she has it, but you have to confirm at the other testing. But
Absolutely. I think it's good to say it. I think what it does is it validates your medical knowledge as a pediatrician, and you have the suspicion you've administered the appropriate screening test,
Right.
And that you have a suspicion that this is what's going on. And if that suspicion isn't confirmed, I'll tell you, the families will appreciate that you're concerned about their child.
Mm-hmm.
It does not have to be that you got it right on with one screening test, but this is what you're most worried about. And it will spur that family on to get the additional testing that they need to get done.
You discuss Matthew with your preceptor, and together you decide to order an audiogram and call Matthew's parents for a follow-up interview. For Claudia, her explained to Claudia's dad that some of his responses about Claudia's behavior raised concerns about
Follow-up
Claudia's
interview that you do really refines that and significantly increases the sensitivity of this test to the order of it can increase the positive predictive value of this test from 11% to the order of 65%. What would you do in terms of the next step of what should the family walk out and do for their kids? What should you refer them to?
for diagnostic
For
testing.
diagnostic evaluation,
Audiology.
absolutely. Hearing test. What else do these kids need?
Preschool or early
Claudia needs to be in
intervention.
preschool, right? Or how old is she?
2.
She's 2.
She needs to be in early
Early
intervention,
intervention.
right? So, do you know how to get a kid into early intervention in this county, at least? If you move, you got to figure it all out again.
refer him to the Birth to 3 program?
Yep, Help Me Grow
Help Me Grow.
in Hamilton County, First Steps in Northern Kentucky.
Our pediatrician was wonderful. She was very old school and very direct. She didn't sugarcoat anything for us, which I appreciate now. Back then it was hard to hear, but she did recommend that we have him assessed by early intervention for speech. This was for Gabriel, and she did recommend we take him to a developmental pediatrician. It was early intervention who informed us of, I guess, the scattered skills in all the areas that were delayed, and our developmental pediatrician as well. But we saw the early intervention team before that because we had the waiting list for the developmental pediatrician. I would not have had a clue if my pediatrician, I never even heard of early intervention before that. Didn't know the system, never been exposed to special needs kids. I probably wouldn't have known until she would have said something when he was 2 years, 2.5 years. I would have just kept thinking, some children don't talk until they're 4 or 5. He's just one of them.